Fluoxetine is a type of antidepressant, known as a selective serotonin reuptake inhibitor. It's often used to treat depression and sometimes obsessive-compulsive disorder and bulimia. It works by increasing the levels of serotonin in the brain. Serotonin is thought to have a good influence on mood, emotion, and sleep. Fluoxetine helps many people recover from depression, and it has fewer side effects than some other antidepressants. Fluoxetine is available only on prescription. It comes as tablets, capsule, or a liquid that you swallow. Fluoxetine usually takes around 4 to 6 weeks to work. Common side effects include feeling sick, headaches, and trouble sleeping. These side effects are usually mild and go away after a couple of weeks. If you and your doctor decide you should stop taking fluoxetine, your doctor may recommend reducing your dose gradually. This helps to prevent withdrawal side effects. Some people cannot concentrate properly while taking fluoxetine. It might be best to stop driving, cycling, or using machinery for the first few days of treatment until you know how this medicine makes you feel. Fluoxetine will not change your personality, it will simply you feel like yourself again. How and when to take fluoxetine? Dosage. The usual dose of fluoxetine for adults is 20 mg a day. However, you may start at a lower dose and gradually be increased to a maximum dose of 60 mg a day. Some people might need to take a lower dose of fluoxetine. This includes people with liver problems and older people. The usual dose of fluoxetine for children is 10 mg a day, but this may be increased to 20 mg a day. How to take it? You'll usually take fluoxetine once a day, with or without food. You can take fluoxetine at any time, but it's best to stick to the same time every day. If you have trouble sleeping, try taking it in the morning. How long to take it for? Once you are feeling better, it's likely that you will continue to take fluoxetine for several more months. Most doctors recommend that you take antidepressant for 6 months to a year after you no longer feel depressed. Stopping before that time can make depression come back. If you forget to take it, if you occasionally forget to take a dose, just take your next dose the next day at the usual time. Never take 2 doses at the same time to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. Who may not be able to take fluoxetine? Fluoxetine is not suitable for everyone. Check with your doctor before taking it if you have ever had an allergic reaction to fluoxetine or any other medicine. Have a heart problem, as fluoxetine can make your heart beat faster or cause an irregular heartbeat, arrhythmia. Are trying to become pregnant, are already pregnant, or you are breastfeeding. Have glaucoma. Fluoxetine can increase your pressure in your eye. Have epilepsy or are having electroconvulsive treatment. Fluoxetine may increase the risk of having a seizure. Cautions with other medicines. Some medicines can affect the way that fluoxetine works and increase the chance of you having side effects. Tell your doctor if you are taking any of these medicines before you start fluoxetine. Any medicines that affect your heartbeat, as fluoxetine can make your heart beat faster or make your heartbeat irregular. Any other medicines for depression. Some rarely used antidepressants can affect the way fluoxetine works and cause very high blood pressure. This can happen even if you have not taken them for a few weeks. Side effects of fluoxetine. Like all medicines, fluoxetine can cause side effects in some people, but many people have no side effects or only minor ones. Some of the common side effects will gradually improve as your body gets used to it. Common side effects: feeling sick, nausea, headaches, being unable to sleep, diarrhea, feeling tired or weak. Speak to your doctor or pharmacist if the advice on how to cope does not help and the side effects is still bothering you or does not go away.